Did you know that you can use ChatGPT to better understand your prostate cancer? I'm going to show you how it works and everything you need to know to get your own answers. Stick around.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
Hi there, my name is Mark, and in 2015, I was diagnosed with prostate cancer. I had surgery, a prostatectomy. I had my cancer removed, which later came back as a recurrence 9 years later. But here I am today, living, loving life, enjoying everything. And I really appreciate you coming along to listen to my podcast today, whether in audio mode or in video on YouTube. By the way, today's session is going to be a little more visual than usual. So if you're listening to this on audio, I'll try to explain as best I can what we're seeing on the screen. But I really would encourage you who are listening on the audio podcast to get over to YouTube and see what this is all about. Because today is going to be a very good exercise, and I think every one of you will take away some knowledge and some tools and tips that will really help you better understand your prostate cancer. But I first want to have a big warning, okay? This is a disclaimer. What I'm about to show you, it's not proven science, it's not proven medicine, it's all based on technology. So I want you to look at what I'm showing you, assess whether you think it's relevant information to you, but always discuss this with a professional, a medical professional, because computers aren't doctors and doctors aren't computers. But through the use of technology, the knowledge we get from ChatGPT and other tools and your doctor, you should have a clear picture of what's happening to you if indeed you have prostate cancer. So before digging into all of this, I wanted to, for those of you who don't really understand what ChatGPT is, I'm going to give you a very, very easy understanding and introduction to it. Some of you may not be technology focused, but that's just fine. So what is ChatGPT? Well, we're all used to using Google. And if you're looking for something, a restaurant, a recipe, prostate cancer information, you typically go to Google, you type in your search, and what comes back to you is a bunch of links to websites. And then you basically, as you know, you go to each website, you look at it, you peruse it, you assess the information on the data, et cetera. Well, ChatGPT is not quite a super Google, but the way that technology works, the AI, the artificial intelligence, it scours through the internet looking at hundreds of millions, if maybe even billions of web pages, and it remembers everything that it reads and everything that it sees, because it can read pictures, it can tell you what's in photos, it reads journals. And so when it comes to medicine and medical information, it's assessed a huge amount of knowledge. And when you ask it things, it's going to tap into that knowledge and bring back to you the results that it has put together. So as an example, you may go to Google and say, how do I know if I have prostate cancer? And you're going to get a whole bunch of websites. If you go into ChatGPT and ask the same question, you're actually going to get an answer. So it's quite interesting. When it comes to prostate cancer, those of us who have had it or are going through treatment or are newly diagnosed, ChatGPT can be very helpful because it will give you details and information based on its own medical research. Of course, like I said, it's not a doctor, but I found, at least based on my own history with the disease, it's spot on accurate every single time. ChatGPT is prone to error. So at best, I would say if you use it to get information, then take that information, share it with your doctor and medical professionals, and see if they agree. So let's do a very, very quick introduction to ChatGPT and how to use it. Today, I'm actually working on my screen, and because I'm getting into my 60s now, we need some glasses here. So to get started, let's get online and let's find ChatGPT. You can just go to Google and type ChatGPT. and you'll get some information. OpenAI, this is the company behind ChatGPT. But if you just click on this link, you'll get a basic introduction, and you want to try ChatGPT right here. Okay, and this will run in a web browser. There's also apps that you can put on your phone, on your iPad, but this basically is just like a big Google screen. There's a box here where you're going to ask it questions and give it tasks to do. And so I'm going to start off with probably one of the most compelling reasons to use ChatGPT, and that is reading a pathology report. How about that? So let's say you've had surgery and the doctor or the hospital gives you a pathology report and you read it. It might look something like this. Okay, this is my actual pathology report. I kind of blacked out some of the details, but if we go through it, you can see that I had Gleason score 7. They looked at lymph nodes. Okay, the prostate size. All right, and there's a whole bunch of stuff here. Tumors, tumor present, left posterior. What does all this mean? It's a lot of information, a lot of data here. Well, ChatGPT is going to be your best friend, because what you can do with ChatGPT is pull in that pathology report. Okay, so I'm going to come to the window here, and there's a plus here where you upload from your computer. Okay, and I have my pathology report right there, and it's uploading. And when it's finished, you'll see that it just there's a little marker that was moving when it was loading. And you go to ChatGPT and you try to give it as much of an understanding as possible as to what this is and what you want to do with it. You have to give it instructions. So I'm going to say, I had my prostate removed, and here is the pathology report. Tell me what it says, and keep in mind that I am not a doctor. One thing, when you're using ChatGPT to get information, you always want to tell it kind of who you are, not your name. But if I were to say I'm a doctor, it might be a little more technical in its results. If I say I'm not a doctor, it will be a little simpler. And then I'm going to hit enter, and it's going to read that report. And look how fast this comes back. I mean, this is amazing. So it comes back and it says, okay, you had prostatic adenocarcinoma. Your Gleason score was 7. It says it was made up of pattern 3, less aggressive, but some pattern 4 more aggressive. The cancer spread. The tumor was confined to the prostate, meaning it had not spread. No cancer in the lymph nodes, no evidence of invasion. There was some tumor at one surgical margin. You hear this called a positive margin, left posterior inferior, meaning a small amount of cancer was close to the edge of the removed tissue. And this could be a concern for recurrence. And we know 9 years later, I had recurrence. So other findings, no lymphatic or vascular invasion. And the nice thing is, when it interprets something medical, it gives you the layman's version of it. So cancer had not entered blood vessels or lymph channels. Perineural invasion was present. Meaning the cancer was found around the nerves inside the prostate, and that sometimes increases the chance that it will spread. And high grade, I'm going to try to read this out, prostatic intraepithelial neoplasia was noted. So it's a precancerous change, but it's not uncommon. So what does this mean? It gives you a summary. The fact that cancer was contained within the prostate and lymph nodes were clear is reassuring. However, the presence of the tumor at one margin could mean there's a risk for remaining cancer cells, and your doctor may discuss this further with you. So how cool is that? It took this technical report, okay, which is kind of mind-boggling to kind of read, and ChatGPT turned it into something very simple. But I'm going to go a step further. Let's say you want to explain this to a child or a teenager. So I would come down again in ChatGPT, and I would say, now, please explain this to a 10-year-old. Look at this. Let's see what happens, and look how fast it comes back. Okay, so it comes back, and here's how it would explain to a 10-year-old. And this is very helpful if you're ever going to explain a disease or something complicated to a child. So it says, imagine your prostate was like a little apple inside your body, and doctors had to take it out because it had some bad spots, cancer. The doctors looked at the apple under a microscope and saw some bruises. Most of the bruises were small and not too bad, but a few were a little worse. The good news is the bruises did not spread to the seeds, which means the bad stuff didn't travel far. They checked the peel. Remember, we're talking about an apple. The edges where they cut, and in one spot, there was a little bit of a bruise close to the edge. That means they might need to keep an eye on it to make sure none of these bad spots come back. The doctors check with the special tests like PSA to make sure everything stays good. So, I mean, isn't that cool? I think anyone that has a report like this should put this into ChatGPT and just see what it says. And you can use this for a biopsy report. You can do that. You can do this for, once again, the pathology report. Maybe you had radiation, something after that. So it's really cool. But let's go a little further. And since we like to talk about prostate cancer and especially how it affects you, we can go into a new chat with ChatGPT and just get some more details about it. So let's look at how we do that. So if I can keep this chat going, and this will stay here indefinitely unless I delete it. So I can come back next week and continue looking at my pathology. I can ask it to reread it or rewrite it, but I'm going to start a new chat with it. So the way that I do that is I come over here and I start a new chat. And this is very similar to things that we've seen, with regular chat sessions. So you can say, I had my prostate removed in 2015. In 2022, my PSA rose up to 0.4. What do you think is happening? I'm going to use past tense. What do you think happened then? I am not known for my typing skills. Okay, so it comes back and it says after prostatectomy, levels should be undetectable or very close to zero. A rise in PSA suggests the possibility of a biochemical recurrence. And then it just kind of goes through, you probably had some tests. There's some treatment options, doubling time. So you can kind of really drill down on this and you can kind of really get into a rabbit hole here because you can go deeper and deeper and deeper. But the interesting thing about this is that you'll get information from your doctors, and sometimes you have further questions and you can't reach them, or they maybe are not available, or they just can't get back to you. So this is kind of a good way to help figure things out. And let's say I'm going to open a new chat session right now. And here's a question that comes up a lot in my Facebook group. Okay, I am a male that has been recently diagnosed with prostate cancer with Gleason 7. I am 50 years old. Now, I'm currently 60 years old, but let's say I was 50 years old. And what would be the best way for me to treat this? Okay, surgery, radiation, or just wait? And let's see what ChatGPT says. This is a tricky one because a lot of answers to these types of questions are they are subjective, and some doctors will have different opinions. But what ChatGPT says, and remember, it's reading everything in the internet, and it's gathering all types of different opinions, and it's making some assessments here. So it comes back and very nicely says, "I'm sorry to hear about your diagnosis. A Gleason score of 7 typically indicates intermediate risk prostate cancer, and the best treatment approach depends on several factors, including whether it's 3+4 or 4+3, PSA levels, health, personal preferences." So it says here are the main options: active surveillance, and this means you just wait and see if it progresses. Prostate cancer tends to move very slowly. So some people just wait, and they wait to see if the PSA rises. Surgery. This involves removing the prostate. And it says it's often recommended for younger, healthier men with a longer life expectancy. And this is what I believe is the best option, but we're all going to make different choices for ourselves. Then there's radiation therapy and there's hormone therapy. And it says your best course of action depends on a more detailed risk assessment. So ChatGPT is not going to say you're 50 years old, have surgery. It's presented it, and it's given some backup details where healthier men with a longer life expectancy probably are better served with surgery because we can tolerate a lot better. And once you have surgery, if there's recurrence, there's certainly ways to kind of treat it. It brought up a point up here, Gleason 3+4 or 4+3. And I'm always curious what that really means. So right in this chat, I'm going to say, you mentioned above Gleason 3+4 and 4+3. Okay. My biopsy shows that I have both. I'm making up a fictitious assessment here. So I'm pretending I had Gleason 3+4 and 4+3. They're both Gleason 7, but they mean different things. So what is the difference? Okay, and we come back here. Okay, and this is going to be really good because this is going to answer a lot of questions. The difference between Gleason 3+4 and 4+3 is the proportion of more aggressive cancer cells in your tumor. So 3+4, that's the lower risk side of a Gleason 7. So the primary pattern is grade 3. So the less aggressive cancer is primary, whereas the secondary pattern is grade 4. So whenever they assess a Gleason score, they divide it into two patterns. And so, a Gleason 6 is 3+3. I don't know why they don't just call it 6, but anyway, it is what it is. So 4+3 is the higher risk, and it means there's more aggressive cancer than less aggressive cancer, even though you have Gleason 7. So an early part of Gleason 7 is very promising. Promising in the sense that generally it's thought to believe nothing has spread. It's still contained within the prostate. If you get Gleason 7 4+3, it means some of those cancer cells, they're starting to get a little more aggressive. And it's not yet a sign that they've left the prostate or they're dangerous. It just means they're getting a little more aggressive. So you really want to take action at that point. So the assessment here is, since you have both 3+4 and 4+3, the risk assessment, we need other information. We need the percentage of each type found in your biopsy, your PSA. If you have a PSA of, let's say, 4 or 3.8, that's usually pretty good. But if you had Gleason 7 with a PSA of 10 or 12, it may be a little more aggressive. So, those are things to kind of really pay attention to and to kind of watch for. So that's kind of the tool set that's available to you via ChatGPT. There are so many questions you can ask it. Each of you will have different questions. You might have questions about Lupron or Orgovix or the radiation process and what type of radiation is best and when should you have it and should you have it. And if you believe you have recurrence, you can key in your PSA history over a period of time, and it'll make some assumptions based on how long your PSA took to kind of double in time. So there's a lot of things here that a doctor will do. Now, I believe this is the very beginning of very advanced science using AI. ChatGPT is just a knowledge base. It's not really thinking at this point. At least this version is. And there are some newer versions of ChatGPT that actually think. That's for a whole different day. But this very simple version of ChatGPT, it basically takes your questions and looks over millions and millions and millions of pages of information it's stored. And it says, well, I see enough information to be able to create a conclusion, and I present it here to you. So it's a great way to also prepare. I'm going to do one more query with you, and I'm going to start a new chat, and I'm going to say, hello. I am a 64-year-old male. I have just been diagnosed with prostate cancer, and I am about to meet with a surgeon to discuss surgery. What are all the questions I should ask the surgeon so that I best understand my typing, what lies ahead of me and how to prepare myself for surgery? I'm just laughing because I type so fast and I make a lot of mistakes. Okay, so what does ChatGPT say about meeting with your surgeon? Once again, it has apologized. I'm sorry to hear about your diagnosis. So you can create a list and bring this with you to meet with your surgeon. Understand your diagnosis. What are the options? How do I prepare? What's the recovery and what are the side effects? What about sexual function and urinary function? What's the long-term follow-up? Other treatment options? All right. So there's 35 questions there. I'm not sure I would sit and go through each one, but this will kind of give you a thinking point of it. One thing that ChatGPT did not include in this list of questions is the qualification for the doctor. So I'm going to type in now, how about some questions that I can ask the surgeon to help me feel that he is not only qualified for the surgery, but has great experience. All right. So here's the next part of that. So it comes back, ChatGPT, it's very positive. He says, that's a great approach. You want to feel confident that your surgeon is highly experienced. So here's another list. Your surgeon is going to get a lot of questions via lists from you, but what are your qualifications and training? Are you board certified? I would think they would be. Number 3, how many prostatectomies have you performed? Great question. I would like to see a surgeon have at least 2,000 surgeries under his belt before working on my body. Do you specialize in prostate cancer surgery, or do you do other types? You would like to have a surgeon that does mainly these surgeries. They don't always do only one type of surgery, but prostate cancer, prostatectomy has to be huge in their wheelhouse for what they do. What's your success rate? I don't know if they're going to answer that question. How many of your patients remain cancer-free? So there's questions here, and you can go ahead and you can ask these questions. I will put in the comments on my YouTube feed for this video, I'll put these queries and these answers in there. because some of them may be useful to you, and hopefully they will have some value to you. So that's sort of what I wanted to go through in this session. This was a very technical, very hands-on, very computer-focused. Those of you, like I said, who are listening on audio, on podcast, maybe won't benefit as well from what we're seeing on the screen, but hopefully I verbalized some of the results and what some of the approach is. I'd also be very curious to learn of your own experiences with ChatGPT. You can use it for anything. I use it all the time, but I think when it comes to these severe diseases, prostate cancer, other types of cancer, it's very, very useful. I wouldn't necessarily go to ChatGPT and try to diagnose what's happening to me. If I'm not feeling well and have a fever and a sore throat and runny nose, I don't know if I go to ChatGPT and say, what's happening to me, because there are so many different causes of typical symptoms. But when you get to a point where you have factual information, whether it's a pathology report, a biopsy report, ChatGPT can really help you interpret the information and then help you understand, make it more clear what's in the report. Because I know I've sat with doctors when they read reports and they understand what's in them, but I usually don't. So I have to rely on my own research. So I hope this is very helpful to you. This is my first podcast of 2025. And I look forward to continuing these into the new year. I'm working on bettering my studio a little bit, but for now, at least, I think it looks good. I'm glad to be here for you. Keep posting comments, keep posting your likes. It really helps if you subscribe and pass on the links to these podcasts or video feeds to people that you know. And my mission here is to really help others understand. This is about information sharing, information gathering. And to me, there's no better experience than having I should say there's no better way to understand a situation than by having people who have experienced it tell you what they went through and give you some of their comments. So that's why some of the comments that you all put into the different Facebook and these different areas are very helpful. So I want to wish all of you a great I was going to say start of the spring. I'm in North Carolina right now, and it's still winter here, but spring is starting to rear its head. I know in the Northeast it's still pretty wintry, so I wish you all the best and keep looking for more podcasts